Good morning, everybody. Thank you so much for
Good morning.
joining. I just heads up, we are recording right now. So I see there are a couple pings happening right now, so we'll let everybody get in from the lobby and mute themselves. So good morning. Welcome to our virtual press conference for Pennie, PA's official health insurance marketplace. My name's Chachi Angelo. I'm Pennie's Director of External Affairs. And we're here today to talk about many important things about Pennie's open enrollment period, but the most pressing is the upcoming deadline of December 15th. A few housekeeping items before we begin. Please mute your line if you're joined via phone. That may be *6, and there will be time for questions at the end. Today, you're going to hear from Pennie's Executive Director, Devin Trolley, and not one, but two members of Pennie's Board of Directors, the first being our chairperson, Pennsylvania Insurance Commissioner Michael Humphreys. The second is Antoinette Kraus, Executive Director of Pennsylvania Health Access Network, or PHAN. We'll also hear from a Pennie sister, Lisa Cox, and we've also assembled some customer testimonials because it's nice to hear from the experts on the topic, but hearing it straight from the people that benefit from Pennie helps too. And then we'll open it up for a Q&A. Again, thank you for logging on today. The press release will be sent around this afternoon and will include the recording of this press conference. And now our first speaker, Pennie Executive Director, Devin Trolley.
Thanks, Chachi, and thank you everyone for being here today. We wanted to share some important news about health coverage options for Pennsylvanians. So if you take one message from today, it's that Pennsylvanians have options for affordable and quality health coverage, but action is needed and there are important deadlines to meet to give yourself the peace of mind and protection of health coverage. So we're here to talk about Pennie, which is Pennsylvania's official health insurance marketplace. I'm Devin Trolley, the Executive Director of Pennie, and here to talk about high quality coverage and the financial savings we offer Pennsylvanians. We're here today in particular because it is open enrollment. That means it's the only time of year to enroll for 2024. And a very important deadline is coming up on December 15th. That's the date that people need to enroll in order to have coverage starting New Year's Day. So if you don't get coverage from other places or you're not familiar with Pennie, there are a couple of important differences that Pennie offers. And those two things are really make Pennie different from other options in Pennsylvania. One is that the coverage offered through Pennie is high quality. Pennie is not an insurance company. We offer health plans from many insurance companies and people can compare those side to side. And all plans offered through Pennie must provide comprehensive care that includes hospitalizations, doctor's visits, maternity care, mental health services, and much more. All health plans offered through Pennie also must provide financial protection to consumers. That means if people have significant injuries or illnesses, what is maxed out is what the consumer pays, and the insurance company pays the rest. Also, there's care for pre-existing conditions and many free preventive services. So those are some of the key benefits of having the high quality coverage through Pennie. And the other main difference that Pennie has, and this is the really important one, is that we're the only source of financial help to lower the cost of these high quality plans. Monthly premiums through Pennie are based on household income. So those who make less, pay less, sometimes even less than $1 a month for comprehensive health coverage. Those who make more pay more of the monthly cost, but no one pays more than 8.5% of their household income towards coverage. Outside of Pennie, sometimes there are low-cost plans that say they have comprehensive coverage, but oftentimes there's exclusions in the fine print, and those low costs are achieved because they shift costs to consumers. That's not the case with Pennie. Pennie has high-quality health plans, and the low costs are achieved by providing on-the-spot tax credits that are only available through Pennie, and those on-the-spot tax credits lower the costs of monthly premiums. So there's a lot of benefits to having coverage through Pennie. More than 360,000 Pennsylvanians have already experienced these great benefits, but around 700,000 Pennsylvanians are still uninsured. We hear a few different reasons for this. And if this sounds like you, then there are some things to consider. Some people think that they don't need it. They think, well, I don't have a lot of health problems. I am relatively healthy. And I think if this is you, then something to think about is that you never really know when you're going to get sick or injured. We hear from people all the time who had an unexpected ankle injury or had gotten in an accident. And this can cause people to go thousands of dollars in debt, especially when people are younger and trying to start out in their careers or in their jobs, and have very little financial savings. This can have a really significant negative impact for people who might get sick without, which is something you really can't plan for. So you can't plan for getting sick or injured, but you can plan ahead by having health insurance and getting that financial protection. We also hear from people who know they need health coverage, but don't think they can afford it. And that's another really key benefit, again, of Pennie. 9 out of 10 Pennie enrollees have savings, financial savings on their health insurance coverage at an average of $500 a month or $6,000 a year. All the time, we get feedback from people that they're surprised and relieved that a quality health plan can fit in their budget. If you haven't looked at your options recently, there is a very quick way to find out if you could qualify for savings. On pennie.com, that's PENNIE.com, there's a 3-question savings calculator. All you have to do is put in your zip code, how many people in your household, and how much money your household makes. And then right away, you'll be able to see how many savings you could get through Pennie to lower the cost of coverage and see if there are plans within your budget. This is a quick way to see what your options are and if affordable quality coverage is within your reach for next year. We also hear from people that they don't know where to start. So one thing to say if you're in this boat is that Pennie is here to help. We have a full range of experts. You can call a call center. You can go on our website, which has a lot of information. We even have a chat feature if you want answers to your questions but aren't able to make a phone call. And we also have in-person help across Pennsylvania. And you'll hear from some of our assisters later on today who will share some of their experiences with helping individuals enroll in coverage. You can find people in your area by going to pennie.com/connect. You put in your zip code and you can see a whole bunch of people who are trained in Pennie, and they can help you through the application process and the enrollment process. One of our customers, Blake, who lives in the Philadelphia area, has had this to say about the process. He said, "I was a little intimidated by the whole process, but I soon realized that it was easier than I thought. It was a surprisingly quick and easy process, and I was guided through it all by helpful and friendly people that were happy to help me figure things out." Blake also had this to say, "I would tell people to take advantage of this helpful tool and help yourself find some peace of mind going into the new year." So let's talk about that for a little bit, of having that peace of mind in the new year and what it means to be uninsured versus what it means to have coverage. If you don't have coverage, that means you're missing out on important healthcare services. It also means you could be putting yourself at financial risk if you get sick or injured. Having coverage, on the other hand, means that you have that peace of mind that you have financial protection in the case of unexpected illness or injury. You also have access to preventive care to catch medical issues early on before they become bigger issues. And you have access to a full range of medical care to treat known conditions or to manage conditions that you have, like diabetes or other chronic conditions. We often hear stories about the stress of paying for medical care. And, we hear from stories from people who if they or someone they love gets in an accident or has a medical injury, that's the overall stress of dealing with that. And the last thing that we want anyone to have to think about at that time is what it takes to pay for that care instead of what it takes to get better. So having health coverage means that you can focus on your care and you can have the peace of mind that it won't have a negative impact on your finances. So that's what we really mean by peace of mind. If you have been enrolled in Pennie already, open enrollment is also an important time for you. Plans and prices change every year, so it's important that you update your information at pennie.com in your account. And you also should review your plan options to see if the plan you have is still the best one for 2024. Whether you're looking for coverage or looking to make a change to your coverage, the deadlines are the same. The upcoming deadline is a very important one. That's December 15th. December 15th is the date where you need to enroll or make changes to your enrollment by to have them take effect New Year's Day. So we know the holidays are coming up and there's a lot on people's minds. We really encourage everyone to have their coverage taken care of before going into the holiday season. So that's one less thing to think about at the end of the year. But to sum up the key point for today, if you need health coverage, Pennie has the lowest cost on high quality health plans. You can get covered for 2024 by enrolling today at pennie.com. And remember, the deadline is December 15th to be covered New Year's Day. And now, to talk more about the health plan options here in Pennsylvania, it is my pleasure to introduce Michael Humphreys, Commissioner of the Pennsylvania Insurance Department.
Thanks, Devin. Appreciate the opportunity to be here with everyone today. Good morning. I am Mike Humphreys. I'm the Insurance Commissioner, and I have the pleasure of serving the Shapiro administration. At the Insurance Department, you may ask why we're on this meeting. Not only do I chair the Pennie board, but the Insurance Department's role in approving Pennie plans means that the plans that are being offered to individuals through Pennie, both how much they're charging individuals and the benefits being provided by that plan, come through our insurance department process, where we can make sure they are fully compliant with both federal requirements and state requirements in terms of the robust benefit options and being offered at a price point that is not inadequate or excessive for policyholders. And I really want to focus on mostly the last point that Devin made, which is 10 days left to ensure we have coverage for January 1. December 15th is the deadline that individuals want to make sure that they have gone into pennie.com and selected their plan, maybe changed their plan. And from the insurance commissioner perspective, I would strongly encourage individuals to go back in and look at what plan options that they have for next year, because each year they change. The rates may change, the benefits or the companies that are offering in your area, they may change. Like today, if I look at the rates that were approved kind of on the Commonwealth, across the Commonwealth, the average rate increase is 3.9%. But that's across all plans, taking into effect the volume at each plan level. But that doesn't mean every plan is going to increase by 3.9%. Some plans were approved with rate decreases from 2023 to 2024. Other plans saw a more significant rate increase. So the point being that to ensure the benefits that you want to have in 2024 are at a price point that you are comfortable paying, we strongly encourage you to visit pennie.com to view the options that are available to you. Not only may have cost change, but as I mentioned, there could be different plan offerings. Each year, since Pennsylvania has organized and administered its own exchange, which is Pennie, we've had companies either grow and expand their footprint across the Commonwealth. In certain cases, new companies come in and offer new plans where policyholders wouldn't have seen them. So if I were to say auto enroll from 23 to 24 in Philadelphia County, I may not have gone to see what options are available to me that weren't there 2023. But today, what you'll see on the exchange is Highmark Insurance Company. They're moving into Bucks County, Chester County, Delaware County, Montgomery County, Philadelphia County for the first time. Geisinger expanded where it's offering health plans into Bedford County. And Jefferson Health Plans is coming on the exchange for the first time. And you'll see them in Southeast Philadelphia or Pennsylvania. So really, in addition to kind of looking at what costs may be available to you, we want people to go on to pennie.com to look at the companies that are available to them. Look at the networks. When you look at a plan, look to make sure the doctors that you see, maybe the prescriptions that you take, are available through the company network or the formulary that the company may be offering, to really make sure that it is the best plan for you. And one area where I think we try to take away some of that worry is when you're going on pennie.com, you can be comfortable in knowing that these plans are going to be robust. They're going to have the 10 essential health benefits that are required, and that includes benefits around hospitalization, emergency, pregnancy and maternity care, preventative services, immunizations, importantly, mental health and substance use disorder services. And when I talk about having these essential health benefits available in the plan, remember this is without pre-existing condition exclusions. Often, and it's unfortunate, but what we hear at the insurance department is we'll get complaints for individuals who really thought that they did themselves right, found a plan that was going to be comprehensive and afford them the benefits that they were looking for throughout the year, only to find out after they had gone to seek health care services that instead of being enrolled in a comprehensive Pennie plan, an ACA compliant plan, that it was a limited duration benefit plan or a disease specific plan. And these benefit plans, though approved by the department, they're really different. They're not for comprehensive coverage over an extended period of time. So the individuals that we see that come to us with complaints, maybe they didn't have coverage because of a pre-existing condition requirement. They didn't have coverage because the benefit maxed out. They didn't have coverage for any number of reasons that is not allowed to hold back coverage certain services through the Affordable Care Act, through Pennie plans. So really the highlights for us, and the reason I'm here today, is to really stress that these comprehensive plans at the most affordable option to policyholders are available through Pennie. It is the only place that a policyholder will qualify for tax assistance in affording premiums is through the Pennie structure. You're not going to get that from non-compliant, non-Pennie plans who maybe have a low premium, but will not have all of these exhaustive and comprehensive benefits that you'll see through Pennie. So one other point that I wanted to make before I turn it over is really to stress that the insurance department is here to help. If individuals have questions as they're looking through plan options or coverage options, or they've gone and had a healthcare visit only to be told that their claim has been denied for any reason, please contact the insurance department. It's insurance.pa.gov, and I have a team that's dedicated to consumer services. They will take the policyholder's call. They'll try to help the policyholder understand what may be covered, may not be covered, answer any questions, and then also we'll go back to the insurance company and we'll say, look, this individual had this comprehensive policy. They were told that the coverage is going to be denied. Why? Explain to us why that coverage isn't being provided, and really try to step in the shoes of the consumer, because it can be a challenge to negotiate an insurance denial. And I'll put in one plug for a report that we issued earlier this year, trying to bring transparency to claims denial processes and appeals processes. It was our first year report, so I'm going to be really interested to see year over year, because the claims denial rates were obviously higher than what we would have liked to see, and very, very few people actually will appeal a claim through us, through the insurance company. But when they do, they are pretty successful in getting that overturned. So wanting to raise awareness not only through the appeals process and the PID process, but really just making sure everyone knows that there are advocates for them in a health insurance context. And I know I'm going to turn it over to Antoinette in a moment, who's one of the leaders in consumer advocacy across the Commonwealth. But please know, through the private sector, through the public sector, that there are people here that can help you. So again, in closing, December 15th, let's go on to Pennie. Let's look at what options are available for comprehensive coverage at prices that subsidies and tax credits may help us afford, to make sure that we are continuously covered into the new year. To have that coverage 1/1 of 2024, we've got to enroll. We've got to pick a plan by December 15th. So really enjoyed being here. Look forward to any follow-up questions either here or through email or calls afterwards. And I will turn it over to FAN Executive Director Antoinette.
Thank you. And thank you, Commissioner Humphreys and Devin, for pulling this together today. So not only am I a proud Pennie board member, but I'm also the executive director of the Pennsylvania Health Access Network. We are an advocacy organization whose main goal is to make sure that healthcare is accessible and affordable to everyone. We also run a consumer assistance program that helps folks in about 67 of Pennsylvania's counties, and we field about 10,000 calls a year. What we know is that going uninsured can often lead to more serious health complications, more costly forms of care down the road, and it can also lead to medical debt. We released a study earlier this year that shows that 1 in 4 Pennsylvanians are struggling with medical debt, and a big part of that is from folks that have gone uninsured. You know, last week we had a woman who didn't know about Pennie. She called our consumer assistance program. She had $95,000 in hospital debt. She had no idea Pennie existed, and our enrollment assisters have been helping connect her to coverage. I think what's really important for people to think about is that coverage is affordable. 9 out of 10 individuals qualify for financial assistance. All Pennie plans cover free preventative care that helps catch things early, so that you're not catching serious illnesses or complications further down the road. We also want to talk about folks who previously may have qualified for Medicaid, who may have received a notice that they're no longer eligible for Medicaid and don't know where to turn. I think we want to tell folks Pennie is here for you. You probably qualify for financial assistance. In fact, you know, earlier this year, we helped a gentleman in southwestern Pennsylvania who was a caregiver for his disabled son. He lost his job during the pandemic and was grateful to get Medicaid coverage. He has since gained employment, and he found out he's no longer eligible for Medicaid because his income increased. He was actually able to get a Pennie plan for $69 a month with $0 deductible for a part of 2023. He went back, he did his shopping for his renewal for 2024, and he found out that his premium would be even lower. And now he's paying $17 a month with a $0 deductible. He was very grateful to have Medicaid coverage, but is super happy that Pennie was there and that he was able to enroll in a Pennie plan that was low cost and covered their healthcare needs. So I think that story shows us 2 things. 1, don't wait to shop. December 15th is the deadline to enroll in coverage January 1st. It's always important to go back and update your information because you might find that there's a plan that's even more affordable or you're eligible for more financial assistance. So the process is easy. You can go online. Organizations like FAN and Lisa Cox, who's going to speak next, who is a Pennie assister, are also available to help walk people through the process, you know, over the phone, in person, to help hold your hand if you have questions. So you shouldn't wait because you're nervous about the process. There is help for that. 9 out of 10 individuals qualify for financial assistance. And it's really important not to delay. We all procrastinate. I procrastinate. But that December 15th deadline is really important as we look to make sure as many people are covered as possible by January 1st. So with that, I will hand it over to Pennie assister Lisa Cox to talk more about how you can connect with an assister and how they can make the process even easier for folks.
Lisa, just to mitigate some background noise, I had muted you earlier, so just make sure that you come off of mute before you start talking. Nope, you're still muted. There you go.
All right. Thank you, Antoinette. Hi, everyone. I'm Lisa Cox. Happy to be here. As an assister, I have had many rewarding experiences. So many people feel they cannot retire early due to the cost of insurance. And once they find out what the cost and the quality of the plans are that are offered, they're actually quite disappointed that they have not been able to retire sooner had they known that. Families are finding rates that work well for their family's budget and know that any health issues that arise, they will be able to be addressed. Another thing would be clients with life-threatening health issues breathe a sigh of relief when they know that we can find the plans that their specialist will accept, which is huge. Enrollment is a very, very easy process. When enrolling, all we need is the individual's information that are in the same taxable household. So date of birth, social security numbers, and taxable income are going to definitely make that enrollment easier and is needed. And we also will search to be sure your providers and medications will work well with the plan you choose. And I encourage everyone who feels they cannot possibly afford or understand health insurance to reach out to your local support for enrollment and assistance and for detailed knowledge of your health plan during open enrollment. And just happy. It's such a wonderful job to have and so rewarding, and to see so many families taken care of with wonderful health plans. Next is Chachi, who is Pennie's Director of External Affairs. Thank you.
Thanks, Lisa. I know how busy you are at this time of the year, so yeah, I know your calendar's stacked with appointments, so we really appreciate you taking time to spread the word. So
Thank you.
now we're gonna hear from a couple Pennie customers. We spoke with them late last week and yesterday, so apologies on the quick edits, but I think you'll see, combined with the stories that Devin and Antoinette and Lisa all shared, that Pennie's here to help all Pennsylvanians no matter their circumstance, whether they have a chronic illness like Jason you'll hear, or just an active person like Josh. So give me 1 second and I will share this.
My name's Jason Helwig, and I currently live in Waynesboro, Pennsylvania. I grew up in Hanover, Pennsylvania. In July of 2022, my condition that I have, an ongoing genetic disease called CMT, that I've been trying to just push through and work as hard as I could. It just really accelerated and got me to a point where I had to make the really hard decision and listen to my loved ones, my friends, that they've been saying for years, you really just, you need to take care of your body. And unfortunate thing was the amount of money I was receiving from Social Security for working the years that I had was just over the threshold, and I didn't know what to do. So I talked to people, and that's how I found out about Pennie. So when you don't qualify for state benefits, then you are referred to Pennie Marketplace, which is a great organization that has a lot of affordable health care. Got letters in the mail and some more applications to fill out. So I was going through that process. And then there was a lot of things that were going on in my life personally and in my family's life at that time frame, and time had passed. So then when I got a chance to pick up the ball and start rolling with Pennie again, I didn't know at the time, but the 60-day open window had passed. And it got to the point where I basically had to wait until the open enrollment period again, which we have right now. And it's so important for everybody to go and get that taken care of. I'm so blessed with any help I can get with my whole financial situation with healthcare. The way that it's set up, I got credit from the state of Pennsylvania every month to pay for healthcare. And it turns out that that covers my premium for every month. So basically I have zero premium to pay for healthcare, which is amazing to me. And that's through Pennie. That's the magic they can give you. You just need to enroll. You got to make sure to get it done during their open enrollment period. Don't be like me and wait. Just get it done, and it can take care of a lot of problems, a lot of stress. I mean, during this whole year with my chronic condition, I went to a doctor, at least one doctor every week, and I didn't have health care. I didn't have insurance. So it adds up real quick. It gets really scary, a lot of stress, but now I can breathe a lot easier. Starting this next year, 2024, everything is all laid out, and I'm going to have healthcare paid for through Pennie, and it's just amazing.
I'm Josh Mauris. I live Meadville, which is just a little bit south of Erie. I work for a restaurant, which the only real insurance is there is just kind of like if accident stuff at work. There's not really health insurance, but I was able to get Medicaid when COVID happened. I was having I'd say health issues, handful of different things. Generally pretty active, so of course, if I get I've had ankle injuries and stuff like that where I've needed to go to need care and stuff like that. I found out through Pennie because a friend of mine put me in contact with Lisa Cox, and then the whole process with Lisa was pretty fast. My coverage officially starts in January. It's affordable for me, so it should work out with my current situation. So I was thankful to be offered it, and that's actually that it's a thing. So that's kind of why I wanted to do this interview too, just in case if it helps other people out too, kind of like in a similar situation. And to wrap it up, generally maybe people my age might not feel like they need health insurance or whatnot, but you kind of realize you're not invincible and things can happen. And also for me, like I was stating previously, it was really easy to acquire and affordable for me. So if you're in need of coverage or whatnot, definitely reach out to Pennie or assistant, and they can take care of you and get you set up and work with you and help you out. So I'm greatly thankful for them and this opportunity to have health insurance through Pennie.
So you heard it from them. The time to act is now for 2024 coverage. Deadline is December 15th. A quick note too: the Pennie customer service call center will actually be open late that day, open until 10 p.m. But don't wait until last minute. Like Antoinette is a procrastinator, and like I am for holiday shopping. But before I open it up to for Q&A for media outlets, Devin, any thoughts on the customer testimonials that we just heard?
Thanks. Yeah, I mean, I think what the customer said, and you heard it right from them, is just that Pennie really is there for people in a lot of different scenarios, whether it's people who aren't sick yet but want to protect themselves in the case that they do get injured, or people who know that they have health needs and want to be smart about protecting themselves financially and really being able to leverage coverage to help them manage that condition and be the healthiest they can be. So we see a lot of that with people who are part-time workers or don't get coverage for their job, gig workers. There's a lot of early retirees. There's a lot of different examples you've heard throughout about how Pennie is there for people who don't have other sources of coverage. And I think another thing that was really evident is just that peace of mind that it brings and the relief that people feel when they know they have that coverage, that they can afford this comprehensive coverage, and that it will be there to help them through any medical issues they have. So was really grateful for those consumers to tell their story and say it directly, because I think it really shows the benefit of Pennie coverage and what we're providing for Pennsylvanians.
All right. Floor is open for questions to the members of the press. So go ahead and come off mute on camera if you want. Identify yourself and your media outlet and ask questions.
Hi, this is David Wenner with the Patriot News Penn Live. Can you hear me?
Yep, hear you just fine.
Is there? I understand the December 15th deadline. Is there though a deadline after that? And if so, how many weeks does it take for the coverage to kick in? And also, I'd like to ask: are there any events that would allow people to sign up for Pennie at other points during the year? Thank you.
Thank you for the question. So on the deadlines, the December 15th deadline is a very important one to have that coverage that starts January 1st, which is why we wanted to have this time today. Open enrollment does extend into January, and for anyone who enrolls after December 15th, their coverage would start February 1st. There are benefits to having full year coverage, that full 12 months of coverage. That means that's your deductibles and any out-of-pocket costs are really sort of counted over a calendar year. So to really get the most out of coverage, we really encourage people to enroll by December 15th for that January 1st coverage date. There is more time for coverage effective February 1st. And on the second question, we do have various enrollment events sort of throughout Pennsylvania. Those events can be found on our website, pennie.com. And Chachi, if you wanted to add anything to that, I know those are ongoing and there are at various locations across the Commonwealth.
Yes, and I at pennie.com, click connect, and you can see the events calendar. There's a lot of like enrollment events that happen throughout the year. David, I don't want to speak for you, but are you speaking to like a special enrollment or a qualifying life event where folks will have opportunities to enroll throughout the year? Is that the?
Yes, I was wondering about, yeah, qualified life events.
Oh, thank you for clarifying. Yeah, so if people have major life events, so that means moving into Pennsylvania, losing other coverage is a very big one that we see if people lose their coverage through their job or are no longer eligible for Medicaid. That would allow them to have in most cases, 60 days to enroll in coverage. Having a baby, getting married, sort of those large household life family events. There's a full list on pennie.com, but those are the main ones that we see. And those do allow people to enroll at a different time in the year. One thing that does not allow a special enrollment period is getting sick or injured. That will not open a special window. So, anyone in that scenario, if they wait until that happens, they'd have to wait all the way until the next open enrollment period.
Okay. Hey, and if someone would miss the December 15th deadline, like what is the absolute like latest for for this enrollment season, the date? When does it end?
Open enrollment typically goes to January 15th.
Okay, thank you.
And I just wanted to add, outside of the special enrollment period, I think it's always important if something changes in your life, regardless of your income, to go back and update it, right? We don't want you to drop coverage in the middle of the year because your income changed and you can't afford Pennie anymore. So it's important to go back to Pennie and update your income so you might be eligible for a greater tax credit to make that insurance affordable. Or, if you got a big bonus, to also go back to Pennie and update your info, because that could change the tax credit that you're eligible for.
Great ad, Antoinette. Any other questions from members of the media?
Hey, you know what? I don't want to get into the weeds, too much, but in light of what Antoinette just said, like you mentioned, like a bonus. I mean, if someone's income went up and they didn't, go back in Pennie and reflect that, I mean, could they be in a situation where they would, have to pay back if their income was too high for the subsidy they were getting?
Yes. Yeah, and I think that that's important to think about during open enrollment, and what we emphasize with the individuals we help. It's based on your projected income. So we try to help folks think about what are those scenarios. And sometimes it's better to overestimate your income so that you don't owe money back at the end of the year. But again, we don't want people to struggle to afford health insurance that's not affordable for them if they think their income is not going to change. So I think it's really important for folks to think about, what does my situation look like for the year? And that's why we always encourage folks to sit down with a sister, because we're able to ask those questions and help people think through those scenarios. The Pennie call center does the same thing. So I think, again, just reach out for help and people can walk you through those different scenarios to make sure that you're getting the financial assistance that best suits where you need to be for the year.
Thank you.
Yep.
Hi, all. This is Nicole Leonard at WHYY. I just had a question. CMS just released their first snapshot of open enrollment a couple of weeks ago. It showed like the first 3 weeks of open enrollment, and it showed some of the numbers of new people who are enrolling in plans, and also the re-enrollment, the automated enrollments for Pennsylvania and other states. So I don't know if this is a question for someone at Pennie or for Mike at the insurance department, but how is Pennsylvania doing so far in the first 3 weeks of open enrollment? Are we seeing the expected usual numbers? Are we off to a slow or fast start, compared to previous years? So, how are we looking so far?
Devin, I'm going to defer to you to take that.
Sure. So we have seen a lot of consumer activity so far this enrollment, which we're always glad to see. It is one note about your question is that anyone who had coverage in 2023, the vast majority, almost 98%, are automatically enrolled for health plan the next year. So we see a good amount of those individuals coming in, shopping, looking around for different plans, which is always great to see. And we've also seen a lot of new consumers as well. So we do feel like there's a lot of people who are hopefully getting the message and coming in because we are seeing a lot of activity on the consumer side with both new consumers and those who are coming in to relook at their coverage options for next year.
And Devin, if I'm not mistaken, I know we talked about this before probably, but because of the disenrollment from, the PHE to the expansions for Medicaid, are you guys expecting to see, especially for new customers to the Pennie marketplace, have you guys prepared for more people, maybe perhaps than in previous years, coming, asking questions about Pennie and looking for plans here than they would, for the last 3 years, right, since the pandemic?
Yes, yeah, that's a great question. And, we have seen already since the Medicaid changes started over 30,000 enrollees who have been found ineligible for Medicaid, and that's happened over the past 6 months. And so we did plan to continue being able to support people coming in who are who are no longer eligible for Medicaid, on top of wanting to be able to support anyone coming in new to Pennie who has maybe been uninsured this whole time and is now looking for coverage. So, we have seen a lot of those questions coming into the call center, and we've structured ourselves to be able to provide that help and support to the larger group that we thought would come in and that we have been seeing come in.
Thank you.
Any other questions? Hearing none, we'll wrap things up. Again, thanks to everybody that joined today. Commissioner Humphreys, Antoinette, Lisa, really appreciate your time, especially during this very, very busy time. And a housekeeping note, again, we'll be posting the press release and video of this press conference this afternoon, and we'll send it around to the same email addresses that we sent around for the advisory. So thanks again for all that joined the press conference today. And remember, December 15th, that first deadline for our open enrollment. Everyone have a great day.
Thanks.
You too.